What's up, my beautiful people? This is your boy Stefan, your Afro-Grenadian ambassador. I welcome you all back to my channel. To all my supporters, viewers, subscribers, channel members, I appreciate you. And don't forget to watch all the ads that are placed on my videos. Well, in this video, my friends, we have our dear beloved Honorable Dickon Mitchell, who have said he is willing to risk his political career to speak the truth and address the crux of the matter, go to the root of the problem, what the problem that is plaguing our healthcare system. Now guys, let's take a listen to what he said, and then we will come back and talk all about it.
Prime Minister Dickon Mitchell has declared his readiness to address the critical issues plaguing Grenada's health sector, even if it risks his political career. Speaking as a guest on GBN's Beyond the Headline Monday night, the Prime Minister emphasized his commitment to reforming the health system.
Developing
the healthcare system has to be comprehensively reformed.
No, agreed. But you know, just this receiving of help, both in terms of the voluntarism from the folks in diaspora and the accepting in Grenada, because that's an easy win and should be a low-hanging fruit.
Right. So I'm hoping we have an organization called GDAC, Grenada Diaspora Advisory Council, which has spent the last 2.5 years giving of the time and energy and bringing a lot of the medical professionals and so on in the diaspora together, whether from London, Canada, the US and so on, who are ready and willing to go, frankly, at our request. It requires us, I'm saying here, the government, the Ministry of Health, Medical and Dental Council, hospital administration staff and so on, to put the necessary arrangements in place that could allow for these medical professionals to begin to come and for us to enter into a rotation process.
Prime Minister Mitchell highlighted the urgent need for systematic reforms to confront the entrenched cultural practices hindering progress in delivering quality healthcare services in Grenada. According to the Prime Minister, many times professionals are willing to give back but are faced with challenges created by those who work in the healthcare system.
Obviously, as the Prime Minister of the country, I am prepared to tackle the challenge. I am prepared to be voted out of office for speaking the truth. Because mark my word, if we don't address this issue, 5, 10, 15 years from now, it will be even worse.
Indeed, we do need a reformation in our healthcare system. You know, our Prime Minister have disclosed that much of the problem that is plaguing our healthcare system is not coming from the outside, but sad to say, unfortunately, it is healthcare practitioners. Now, I greatly respect the doctors and nurses who are working hard in our healthcare system and trying to make it better. But we have to face the reality. As our Prime Minister is saying, there are some healthcare practitioners, people in authority in the general hospital, who is fighting and sabotaging the progress. And as he said, it is a cultural practice that when you speak the truth, you know, you are tend to be victimized, ridiculed, and censored. But the Prime Minister is saying that he is willing to risk his political career, if that means to be voted out of office, to speak the truth and address the issue. At least someone is trying to address the issue. And I must compliment the Prime Minister for that. I continue to not exalt, but I continue to praise the efforts, right? I continue to praise the efforts of the Prime Minister, Dickon Mitchell. He's so young and he is willing to take the bull by the horn and address the matter, because too much things are going on in our healthcare system that is unaccounted for. Too much people, irresponsible actions that is allowing and resulting more Grenadians dying. A lot of Grenadians dying when they should not be dying. A lot of Grenadians receiving poor healthcare services that is making the situation worse than it is. too much of people on the inside of the general hospital is getting away with the irresponsible actions. Not all of them, but some of them. And the Prime Minister is saying that he's willing to address the issue. And I'm happy that we have a leader that is courageous and is willing to go to the crux of the matter and reform, if that means to get those people inside of there who is responsible for that problem that is plaguing our healthcare system, if that means to fire them or whatever needs to be done, it has to be done, because for far too long our healthcare system here in Grenada has been under the radar, has been in the black book, have not, the reputation of our healthcare system is not good at all. The reputation of the general hospital, is not good. Some people labels the general hospital as a death trap, a death house. Literally, I have seen people with my own eyes, when they are hospitalized in Princess Alice Hospital up here in St. Andrews in Maribor, and they are told they need to go down to the general hospital. There are some people who cry. There are some people who pack up their things and they try to run away from being sent down to the general hospital because of the fear, the reputation, that the general hospital has. And so, guys, I welcome this initiative. I welcome this initiative, and I pray that, God will give our Prime Minister the courage. He will give him the wisdom. He will give him the support that he needs, because not everybody will support him now, because we have this political tribalism that exists here in Grenada. There's a political tribalism that exists here in Grenada that is causing us to go backwards than forward. And this has to stop. There are some surrogates, there is some political surrogates on the inside, that is sabotaging, the progress that have to be made, sabotaging the transformation agenda that Grenada needs so badly. Let me put it that way. And you guys I am not picking any sides. As I said before many times, and those of you who likes to be political and you're ready to judge and say, oh, I knew it, Afro-Grenadian is for this political party. No, you can go back in many of my videos what I did about the general hospital, that is on my channel. You can go back to many of my videos. I do not pick sides. I don't get any rewards from any political party here in Grenada. I don't associate myself with any political party or organization here in Grenada. But what I speak the truth. I give honor where honor is due. I give honor where honor is due. And the Prime Minister will always have my respect. The fact that he said he's willing to risk his political voted out of office in speaking the truth, rather than staying silent and pretending and hiding and covering up the problem that is plaguing our healthcare system. That young Prime Minister that we have deserve my respect. And so, guys, this is the situation. This is the problem that we have here in our healthcare system. It is individuals, not all, but some individuals inside of this general hospital, sabotaging. As he said, the Prime Minister said, they find many of the times, the government find themselves fighting against certain authorities in the general hospital in receiving the help that will help us and our healthcare system to improve. But there are certain individuals that are inside of there fighting the progress. And the Prime Minister spilled the beans right there. He spilled the beans right there. And it will not be easy. There will be some people that will come against him for that. But guys, I pray that there will be a breakthrough. That is what? That there will be a breakthrough in our healthcare system. Because only one hospital that Grenadians have. They can go and receive healthcare services without having a big bill, without getting a big bill. All other hospital in Grenada that there is or may exist is private, and if you don't have money, you can't go there. You know, only the general hospital. Grenadians depend on the general hospital. There are some people cannot afford to buy a plane ticket, jump a plane, and go receive treatment in other foreign developed nations. There's a lot of Grenadians, 99% of Grenadians cannot afford to jump a plane and go to America, go to the United Kingdom, go to Canada, or where the healthcare system is top notch. A lot of Grenadians cannot do that. Most Grenadians, their last result when it comes to the healthcare, you know, is the general hospital, and that includes myself. So we need to address this issue, because too much of Grenadians' lives are at stake because of this poor healthcare services that we have, this broken healthcare system that we have, and it is because of a certain few individuals, as the Prime Minister have revealed. And what the Prime Minister said is correct. It is correct, because this is not the first time I've heard people saying this. I have heard it in my own ears, that the opposition, the problem is not externally but internally. So guys, thank you for watching. Take care until next time in my upcoming videos.